I asked a bunch of doctors which test is often overordered in their specialties. I'll go first. Chest x-rays for pre-surgical clearances.
By far the chest x-ray.
Chest x-rays, which people often reflexively order if a kid has a viral illness or asthma. Listen, you don't often need a chest x-ray to diagnose these things, and if it's not gonna change your management, don't order it.
For those who are asymptomatic, low risk, ordering a chest x-ray as part of a pre-surgical clearance, it's almost never clinically meaningful. It's literally just gonna raise false flags, give people anxiety, and is not valuable. Plus you're exposing them to radiation.
My name is Dr. Anthony Youn, and I'm a board-certified plastic surgeon and podcaster. Injectable fillers are a case where a little bit is a good thing, but a lot of it is not. Many years ago, I co-authored a paper called The Volumetric Facelift. And this is one of the first papers that explained facial aging in 3 dimensions. As we age, we not only sag, but we also lose volume. And in the paper, we recommended injections of fat to help with that volume loss. We'll credit plastic surgeons on taking a good idea, which is a conservative enhancement of volume in the face, and thinking that a lot more of it is an even better idea, and that is not true. Over-injecting fillers are why we are seeing so many people in Hollywood with chipmunk cheeks and Vienna sausage lips. Fillers can be a great anti-aging tool, but only when they're used very conservatively.
The pregnancy test.
A blood pregnancy test.
We literally get pregnancy tests on every woman. It doesn't even matter if they don't have a uterus. They make you get a pregnancy test on every single female.
When someone has a pregnancy that has been seen on ultrasound in the uterus, there are very few instances where a serum or blood HCG test is actually helpful in making a plan or predicting the outcome of the pregnancy. Yet I see it ordered on people who are 18, 25 weeks pregnant all the time. This is really an unnecessary cost on the healthcare system, but also an unnecessary blood draw for the patient and whatever they came in for that helps us really very little to none in making a plan for the patient.
Hi, I'm Dr. Dana Figura, and I'm a podiatrist, which is a foot and ankle specialist and surgeon. A lot of surface level bacterial cultures are unnecessary or even misleading. For example, if you take a swab culture of an ingrown toenail or a shallow wound, it will often grow bacteria that aren't actually causing the infection, like normal skin flora, which can mislead treatment and even lead to unnecessary antibiotics.
I'm Dr. Gary Linkov, double board certified in otolaryngology and facial plastic surgery. Hormone panels are definitely overordered in hair loss cases, especially for men. In most cases of male pattern baldness, we already know that DHT is the primary driver, so ordering routine blood work usually does not change management. Full hormone workups will usually create more confusion than clarity.
My name is Dr. Jake Goodman, and I'm a psychiatrist, which means that I help people with their mental health. In my field of psychiatry, the problem isn't over-testing, it's actually under-testing. I've seen people diagnosed with generalized anxiety disorder or major depressive disorder without anyone ever checking basic labs. You know what can mimic anxiety? An overactive thyroid. And you know what can look a lot like depression? An underactive one. Before we jump to a mental health diagnosis, we need to rule out common medical conditions.
Hi, I'm Dr. Myro Figura, board-certified anesthesiologist, and that means I put people to sleep for surgery, and even more importantly, I wake them up after surgery. A pregnant lady comes in labor in lots of pain, begging for an epidural. She's healthy and has no bleeding risk. I see so many providers in that case just wait for labs to come back. But you don't need to do that. There are now several medical societies that completely agree that you don't need to wait for labs for an epidural. The risk is so low. Do the epidural, do not delay her pain control, do not wait for labs unless there's a reason to. Childbirth pain is no joke.
I'm Dr. Rena, Malik, urologist and pelvic surgeon, and I'm basically a medical and surgical doctor of anything that controls urination as well as sexual function. One test that's overordered in my specialty is PSA, or prostate-specific antigen, and not for regular aged guys. PSA is indicated for guys from the age of 55 to 69, even earlier if you have a family history or have other risk factors. But a lot of people order PSAs for guys who are above 69. Now, this is is a place where you have a discussion with your doctor because prostate cancer is extremely slow growing, and PSA is a screening test for prostate cancer. So if you test it and we were able to find prostate cancer today based on a screening test for PSA, you would probably die of something else in the next 10 to 15 years before prostate cancer ever became a problem. So it's a difficult discussion to have, to talk about when you might die. But if you're very sick and have lots of medical conditions and your parents died at a young age, then it's likely that you are also going to die at a younger age. Or the average age is, generally speaking, 77 for the US population. So you want to have a conversation with your doctor if you're getting a PSA when you're older. This is because it can lead to lots of unnecessary tests, surgeries, radiation that you may not even need.
Hi, I'm Ed Home. I'm a resident doctor in the UK working in emergency medicine. Oh no, it's become a medical meme that all we do in the emergency department is order CT scans for everyone. Joking aside, it's a serious issue as a scan on your abdomen is an additional 3 to 5 years of background radiation. And there are a number of reasons for over-ordering, ranging from defensive medicine, so not wanting to miss things for medico-legal reasons, doctors not having confidence in their history and examination, or maybe not having the time to do them properly, and also feeling pressured by patients into getting scans.
Greetings, well-beings. I'm Dr. Schehrezeade Khan. I'm an internal medicine specialist. That means I take care of your internal organs, keep them happy and healthy so that you don't have to see a specialist. One test that's super over-ordered in internal medicine is the thyroid test for fatigue. Just because you're exhausted doesn't mean it has to be your thyroid. Ask yourself these 3 questions. Are you getting enough sleep at night? Do you have any stress from work or personal situations going on? And lastly, I challenge you to have no alcohol or caffeine for 7 whole days before you go to the doctor and get your thyroid test to see if that improves your energy levels.
Hi, my name is Austin Chang, and I'm an interventional gastroenterologist. One test that's probably over-ordered in my specialty of gastroenterology are guaiac stool tests. So these stool tests are meant to pick up blood, but they're not very accurate and can often detect blood that might be in some of the foods that we eat, like meat. So if we're actually suspecting a bleed in the gut, there are other ways of going about it. And if we're trying to screen for colon cancer, for instance, there are also other types of stool tests that are more specific in detecting cancer-related DNA.
Hi, I'm Dr. Siobhan Deshauer, although online you might know me as Violin MD. I'm a rheumatologist, so I specialize in arthritis and autoimmune diseases. One test that I think gets ordered too often is the ANA. This blood test looks for anti-nuclear antibodies that can show up in autoimmune diseases. But a positive test doesn't mean something's wrong. We can find low levels of these antibodies in up to 20% of healthy people. So when I see a patient with a positive ANA and no other symptoms of an autoimmune disease, I'm usually just reassuring them that they don't have a disease.
I'm Dr. Abby Waldman. I'm a dermatologist and I specialize in skin cancer surgery. I'm gonna get a lot of flack for saying this because I am a Mohs surgeon, but I think that one test procedure that's over-ordered in dermatology may be Mohs surgery. And that's because not every skin cancer needs Mohs surgery. And just because you can have it doesn't mean you should. For example, there are many skin cancers that are in situ or very superficial and just spreading on the top layer of the skin. A lot of times I'll offer my patients that have very superficial skin cancers to use a cream or a destructive measure instead of Mohs surgery.
Hi there, I'm Dr. Benjamin Schmidt, also known as Doc Schmidt, and I'm a gastroenterologist or GI doctor. Cologuard can be a good colon cancer screening test when used appropriately, but sometimes primary doctors order them in patients who really shouldn't be getting them. If you have a history of polyps or a family history of colon cancer, then you should go straight to a colonoscopy for your screening method.
My name is Dr. Elisabeth Potter. I am a board-certified plastic and reconstructive surgeon. So the test that I see over-ordered in my specialty is the breast thermogram. Now, nobody wants to get their mammogram. It can be uncomfortable and it can cause anxiety, but we need to screen for cancer at an early stage. Thermograms just don't do that. They're marketed as comfortable and not involving radiation, but the truth is that they're just detecting temperature change and not cancer.
The first one that comes to mind is coronary calcium score.
The calcium score.
It is a very low radiation imaging test to check for calcium inside the blood vessels around the heart. If calcium is detected, this means that the patient is in increased risk for having a heart attack in the future, for example.
And so many patients of mine come in with severe anxiety because they have some elevation of their calcium score, even though they have no symptoms, little risk factors.
However, I've seen this test ordered many times for patients who are already high risk for cardiovascular disease. And at that point, the calcium score is not really helpful. It's just confirming what we already know, and it's delaying action.
My name is Dr. Hanz Bustamante. My specialty is internal medicine, and I work as a hospitalist. Routine urinalysis is definitely one of the most overordered tests in medicine. It exposes patients to unnecessary antibiotics and leads to drug resistance with really bad outcomes for critically ill patients with severe infections.
Something else that's popular these days? Raw milk. Should you drink it? Click here to find out. And as always, stay happy and healthy.